Hi everyone, my name is Ronan, and I'm very happy to introduce to you my capstone research so far. So first of all, my conceptual research question is, how does game-based interactive media help with smiling depression and how effective are they? And I also want to give you some background information of my topic. So first of all, if you don't know what smiling depression is, smiling depression actually refers to the type of patient who are suffering from depression but without the classical clinical features, which means that the patient may live with unrecognized depression because they want to pretend they were perfectly fine and perfectly happy. So that means that the symptom of smiling depression is the patients are hiding their true feelings from other people, and maybe they're ashamed of their feelings and they're afraid of talking about their true feelings. And that's when I started to be wondering, because smiling depression patients usually afraid of interacting with other people about their true feelings, and we are living in such a technology-based lifestyle, and we interact with our phone every day. So is there any way that the media can help these patients about their problems? And secondly, I want to talk to you about my practice-based research question. So first of all, I am reading some research papers and also doing case studies as my research methodology. And in order to help myself to gain better understanding of my topic, I have made a list of practice-based questions. So the first one is, what is smiling depression? And what are the symptoms of them? And why do the patients want to hide their feelings? So on and so forth. And the second part is about the media part. So how do games help? Do they really make the patients feel less depressed? Do they encourage the patients to talk about their true feelings and seek help from professionals? And also, do different types of games help the patients in different ways? So in order to answer these questions, I have been reading a lot of papers, and the most helpful ones are here. So the first one is called Game-Based Digital Interventions for Depression Therapy, a Systematic Review and Meta-Analysis. I think the special part about this article is this article actually tells you, it proves that yes, games can help patients feel less depressed. And more interestingly, this research has divided the games into 4 different types, which are psychoeducation and training, VR exposure therapy, exercising, and entertainment. And here is the actual article. And the researchers have also found that different types of games are most effective for different patients in different age groups. For example, the VR games are extremely helpful in terms of PTSD patients and young children. And there are also some real numbers from the research, and they were really inspiring. And the second article here is this one called Why Video Games Can Do Better Than Therapy for Anxiety and Depression. So if the first article tells me that, oh yes, games do help, and then this one is the one that tells me why does it help and what is the magic behind all of this. And the special part of this article that's really helpful is that it introduced something called CBT, Cognitive Behavioral Therapy. And CBT is recognized as the golden standard prevention and treatment approach for anxiety and depression. CBT. So related art and practice, I have mainly examined 2 different game-based programs. The first one is called Celeste. The Celeste is actually a 2-dimensional platforming game, and a lot of people may not want to relate this game to depression or something. But the story of this game were actually based on depression and anxiety. The main character, the little girl in this game, has always had a shadow or a ghost character following her, and that ghost or the shadow is a symbol for depression and anxiety, and her mission is to fight or say defeat the shadow through jumping and platforming. So this game is a entertainment type of game, as I mentioned before in the first helpful article. And I think that this game is helping the patients in terms of enhancing their engagement, because you have a symbol of your you have a symbol of your anxiety and depression in this game. And as you finish one level, the player will have a feeling or a sense of achievement, and that encourage them to fight their negative feelings and to release their pressures in the real life. The second one is called Sparks. This one is actually a psychoeducation training type of game, and I will show you here. This game was designed especially to help people with depression. You can choose an avatar here, and it gives you a series of tasks to do. And it also gives you guides saying that you should do 1 or 2 levels a week. This game was actually focusing on teaching the patients of some self-help skills. And it's also utilizing the CBT patterns that I mentioned before. And if you are interested, you can check their website to see more information about them. There are here one page on the website saying the science behind Sparks. And so this is it for my presentation, and I'm looking forward to you guys' feedback.